This is John Giever for MedPage Today in Chicago for the Kidney Cancer Association's annual international symposium. Danish researchers, led by Dr. Krogh Jensen, may have identified an important new risk factor for recurrence following surgery for localized kidney cancer.
From previous studies, we've shown that the presence of intratumoral neutrophils predicts for overall survival following IL-2 in metastatic renal cell cancer patients. So we turned back to the localized setting to see if the same thing was the case in primary tumors of renal cell cancer. So for that purpose, we selected a consecutive cohort of patients who had surgery, radical nephrectomy for clear cell renal cell carcinoma, and we ended up having 123 patients. For those patients, we collected clinical variables from patient records, and we collected tumor specimens and stained for some different immune cell markers, among others CD8, which is T cells, and CD57, which is NK cells, and then CD66B, which are neutrophils. And it turned out that the expression of these different immune cell subsets varies a lot in the different tumors, and we assessed the prognostic impact of presence or absence of all of these cells. And it turned out that the presence of intratumoral neutrophils significantly predicted both recurrence-free survival, cancer-specific survival, and overall survival. Meaning that if you have neutrophils present among the tumor cells, or like as we say intratumoral, you have a very poor prognosis compared to if you don't have. And if you test it unitarily, it was in the range of a threefold risk of developing recurrence or to die of your disease if you have intratumoral presence. We ran a multivariate analysis to show that it was independent, and it turned out that it's independently related to all of these endpoints by, again, hazard ratio about 2, so you have a twofold increased risk of all these, reaching these endpoints.
And so, clinically speaking, what needs to be done from here to turn this into a clinically useful test? And as a prognostic test, what would it imply for management of the patients?
Of course, this is a very small study. It's only 123 observations, and it has to be shown in a much larger study. So we have to validate these data in another retrospective study, but certainly also in a prospective study, before you can see if it adds anything to prognosis or to prognosticate patients, in addition to all the clinical and pathological variables that we're using now.
And what might one do differently with the patients who have this poor prognosis? How would that affect their treatment?
You could, with time, maybe use it to select those patients for adjuvant trials. See that, when you have these cells present, they have, per se, a poor prognosis, and maybe you should try to improve that prognosis and to lower the risk of recurrence. It could also serve as a target for new drugs, for new treatments for renal cell cancer.
Dr. Jensen said the findings may have therapeutic implications as well, but they are still well down the road. I'm John Giever, MedPage Today.